Anderson, who focuses on peripheral neuropathy, shares how to stop painful burning and tingling sensations in your feet for good.
What exactly is peripheral neuropathy?
Well, it's damage to peripheral nerves, which are the nerves in our extremities. So most common, Gina, it affects lower extremities, and patients will notice, nerve pain. It can be anything from numbness, tingling, burning, sharp shooting pain, but it'll usually start off in like the ball of the feet and the toes, and as it progresses, it'll kind of work its way up.
So what causes this?
Well, there's a number of causes, and most people associate peripheral neuropathy with blood sugar problems or diabetes. Even patients who are pre-diabetic can get neuropathy, but there's a lot of things that can cause it. Patients who deal with autoimmune issues, chronic inflammatory problems. Neuropathy can be side effects of certain medications, certain chemotherapies, statin medications can cause it, chronic use of antacids. So there's a number of things, and that's one of the real goals in the beginning, is making sure we understand why patients have it, because a lot of people, they don't know why they have it, or they're told it's idiopathic, meaning there's no known cause, but there is a reason, so we always have to figure that out through extensive testing.
So now that we kind of know what it is, then what are patients actually dealing with if they have it?
Well, most of the time when we see patients, patients are really frustrated because usually they've been dealing with this a long time, and it's just affecting, every aspect of their life, from sleep to their ability to be on their feet because of all the pain and discomfort they have. A lot of patients have real issues with balance because they may not have pain, but they have numbness, and with numbness they don't feel things. So there are fall risks, or they don't feel comfortable driving because they can't feel the gas in the brake. So it's really affecting everything from sleep to mobility to just enjoying activities. It's really frustrating.
So now if untreated or not finding really a root solution to all of this, could it cause long-term complications?
Well, yeah, it can. Neuropathy is known as a progressive condition, so usually over time it is something that gets worse. And as it gets worse, usually it's, more discomfort or more loss of function, more numbness, what's going to affect mobility more. It'll affect balance more. So it's a progressive condition. So
talk about your approach then, because you've been very successful in treating this.
Yeah, and we've been doing this for about 9 years, but what we do in our office is we do a treatment that's one of the most advanced forms of electromedicine. Nerves are electrical. This advancement in technology incorporates really high frequencies and amplitudes of current. And really what the objective is to address the real issue, which is the nerve damage. So with this, we see significant reduction in the neuropathy pain, whether it's burning, sharp shooting electrical pain. We see patients who have numbness or paresthesia start to regain feeling. They start to be more comfortable on their feet, their balance is better. So this advancement in treatment's really allowing us to address the issue, which is the nerve symptom.
So then why would you, can you explain a little bit then why you're getting these results and you're seeing these results and happy patients that maybe they're not getting those results elsewhere?
Well, absolutely. I think when you look at neuropathy as a condition, traditionally, if patients are diagnosed, they're usually treated with a medication, which can be helpful to decrease pain, but as the medication wears off, the pain's right back because we're just treating that symptom.
Right.
So what we're doing and what allows us to be successful is really two things. Number one, the advancement in treatment allows us to address the nerve damage, to get patients out of pain and discomfort, to improve mobility. But the other aspect of this, Gina, is we spend a lot of time in the beginning and making sure we know why patients have it, whether it's diabetes, it's inflammatory issues, it's an autoimmune problem, and we address those underlying issues. And we want to make sure that when this treatment technology gets them better and they get their lives better, we've also addressed the underlying cause to their neuropathy, and they're going to have long-term relief.
Well, now is the time to give Dr. Dean Anderson in his office a call right now. All you have to do is call 303-586-7897. So you can go ahead and set up a consultation right now. That number again is 303-586-7897. Now, when it comes to actual patients who have found that relief, boy, are they excited. Let's take a listen.
When I first started coming to Dr. Anderson, I had no feeling in my feet. It was very, very difficult for me to drive a car because I couldn't feel the brake pedal anymore. What has happened since is absolutely fantastic. I no longer fear losing my balance as I walk. I have feeling in my feet and lower legs again, and driving a car makes me much safer on the roads than I used to be.
Oh, and just having that independence. So what makes your office so unique?
Well, Gina, number one, it's this advancement in treatment and the fact that it's just so comprehensive in what we're doing. We want to make sure we give patients their lives back by addressing the nerve damage, but also the underlying issue.
Well, again, you've been doing this a long time. I know you take great pride in what you do and bringing relief to so many people.
Receive a $27 consultation. This is normally $245. Call 303-586-7897. The consultation includes a review of your health history, a neuropathy-specific evaluation, and a review of past records to determine if you're a good candidate. And that's for treatment. Visit denverneuropathy.com. Dr. Dean Anderson paid for today's appearance. Thanks.